Well, staying with the care sector and in Hertfordshire, there are calls for an inquiry into why so many patients were discharged from hospitals into nursing homes without a COVID test. Figures seen by the BBC show that between March and April, 135 untested hospital patients were sent to care homes from 2 Hertfordshire hospitals. Families of those who died in care homes claim it's an atrocity. John Ironmonger has more.
England is trying to emerge from a crisis that for many will be felt forever.
In his head he was always about 25, had a very dry sense of humour, and he was well liked by lots and lots of people.
Caroline lost her dad Leonard to COVID-19 in May.
I can only assume that he acquired it in his care home. He'd not been anywhere, so that's the only possible source.
Since the start of the pandemic, care homes in Hertfordshire have reported more than 500 deaths from suspected or confirmed COVID-19, including 20 residents here at Pine Lodge in Stevenage. According to one measure, it's among the worst affected counties in the country. In the middle of March, Lister Hospital and others right across the country were given a directive by the head of the NHS. Clear the decks, free up beds ahead of an expected surge of COVID-19 cases by discharging patients into care homes. Now a revelation. During the month that followed in Hertfordshire, the vast majority were discharged untested.
For the 135 patients not presenting symptoms and in keeping with national guidelines, they were discharged into a care home setting without receiving a test for COVID-19.
In a joint statement, Hertfordshire's hospitals told us on the 19th of March, guidance on hospital discharges was published that set out clear instructions. Only those patients presenting symptoms of COVID-19 required a test prior to discharge. But even with hindsight, one opposition councillor believes the guidelines were ill-considered.
We knew at that point that elderly people were more at risk, so why were we discharging people without doing the proper due diligence to make sure it was safe to discharge people to settings where there were lots of old people? Just doesn't make sense to me.
On a visit to Stevenage yesterday, the Labour leader said the government had been slow to act on care homes. For Caroline, her father and others were an afterthought.
No one's really placed any value on them. It's kind of ship them out and the inevitable's going to happen.
The Health Secretary, Matt Hancock, says the care sector has received unprecedented levels of support. But in Hertfordshire and elsewhere, pressure is building to hold a public inquiry. John Ironmonger, BBC Look East.